keep on increasing the amount of data. So the next is chain of thought prompting. Chain of thought prompting is that there is a step-by-step reasoning. Uh, we give them some data, then it provides, and then give it more data, and then give it or more data, thus mirroring the diagnostic reasoning process of clinicians based on data. And this is quite useful in medical education as it brings simulates how a doctor reasons out the patients. It sees the history, then it sees the examination, then it sees the family history, then it sees the investigations, and thus the entire process of how we diagnose patients that is simulated, and ultimately we reach a conclusion. So we'll just initial problem presentation start with a clinical scenario or diagnostic challenge which requires methodical reasoning. This is the first step, and then give it a includes phrases think step by step or reason thoroughly through this systematically to trigger the chain of thought process. Quite often we write the chain of thought process, and then we add uh, provide a framework for reasoning process. First consider the anatomy, physiology, etc., and then maybe think of the what could have triggered, and ultimately ask for the final assessment or conclusion after the reasoning process has been articulated. So we give the prompt in stages. So we'll just show you. If we write, think step by step. How would you differentiate bacterial versus viral meningitis clinically? Consider then step one, consider history, physical examination, findings, laboratory values, and additional tests. Explain your reasoning at each step. So this is chain of thought, and we have given it the order to think step by step. And we have also given it 4 steps. History, differences between bacterial meningitis and viral meningitis, then physical examination, then CSF analysis, then additional investigations, CBC, CRP, blood culture, and then imaging, step-by-step clinical reasoning summary, rapid onset severe systemic signs suggest bacterial, preceding viral prodrome, milder course suggests viral, cloudy CSF, neutrophilic phagocytosis plus low glucose represents bacterial, CSF lymphocytosis and normal glucose is viral, gram staining culture positive, definitive bacterial, CSF PCR positive for enterovirus, definitely viral. And you can also create a teaching slide set or an OSCE or a PDF handout from this only. So everything is dependent on how you ask it. So, and this method is quite useful in uh, teaching the diagnostic reasoning, clinical decision making, and some pharmacological considerations, procedural plannings for medical students. And the students, they develop cognitive skills which can be effective in clinical practice. Okay, we'll just go back.